What do you think the lasting impact of the pandemic will be on health IT?
This is a really good question. As far as lasting impact, I think that there is some, and this is not just IT, but just in general, there's a huge psychological scar, right, to what we've experienced. It was traumatic what happened with COVID, and that trauma, we're going to have to address it as a society and help in IT. It's, because we were working, talk about that pace, that constant pace. I think we're going to have to understand, Bill, how do we navigate and produce the results, but not on the heels of breaking our team's backs. And I think that's probably the biggest challenge. We're seeing it with schools, we're seeing it with the psychological impact to industries as a whole has been really bad. And the frustrations that we're seeing on a daily basis, the increased amount of gun violence, the increased amount of violence on the planes. I think there's a correlation between what we've experienced over the last year being sheltered in place and we're lashing out. And I'm concerned that our industry, we're not being mindful enough of the psychological impact that all of this has had on folks, and that burden as well, that the health IT technology is supposed to help, and in some cases it's not. So I think that I don't have a good answer as far as how do you remediate it, but I do believe that these kind of soft, which are usually traditionally quantified as soft items, are actually not soft at all. They're really going to be impactful to how we navigate in